here's one other battle where your work and your support is critical. And in a sense, it is almost as important. In other ways, it's even more important. And that's healthcare. Look, let me just, I know you agree, but here we are. The president has made this his number one domestic priority. If we're able to, at this moment, and this is a moment when for the first time, Larry, since I've been involved, conservatives and liberals alike understand the need for radical change in our present healthcare system. We are no longer arguing whether it's a privilege or a right to have healthcare in America. And we are no longer, and that's a gigantic change. A gigantic change. Why has that changed? Because American businesses have come to realize that they're at such a competitive disadvantage competing in an international economy when the product they're trying to sell internationally also requires from the profits of that product the requirement to handle all the health care needs of their employees. Because they're competing with countries that have much lower cost healthcare systems. Much lower cost. I used to say before, unfortunately, my state's been devastated. My state's been devastated by the closure of our 2 automobile plants. We're the size of a congressional district. We're a proud state. We had 2 of the best assembly plants in the world, 1 Chrysler, 1 General Motors. They're being shuttered now. And, if you think about it, what used to happen is, I used to be able to say, if you made a Buick Skylark in the plant at Boxwood in Wilmington, Delaware, and then you made the same Buick Skylark in Ontario, Canada, same UAW, same wage base, same material going into the car, same productivity, same everything. You could sell the car made in Ontario for 14% less. So why wouldn't you as a businessman move the plant to Ontario? Why wouldn't you do that? You can make it for less. People aren't in the business of losing money just to stay in America. I know we say that. Sometimes we're kind of unfair to some of these guys. Why wouldn't you do it? Well, you know why they do it? Why they have done it? Because you can sell the car for 14% less in Canada because they have a health care system that's radically different than ours and costs a lot less. So General Motors isn't paying that, what they're paying here. So now businesses have figured out, in order to compete internationally, we've got to bring down the cost of health care. Because guess what? When your health care cost goes up, it's also not just because these are sons of guns who don't want to give you health care, but it's because their health care costs have gone up too. Their health care costs, premiums have gone up 54%. So what do? You either go to your employees and cut their share or make them pay more in. You add it to the cost of the product, which means you're not competitive with other products around the world, or you eliminate it, which is not feasible, thank God, in most cases. So folks, we're at a moment where American business realizes we need a radical change in our healthcare system. Conservatives have figured out, fiscal conservatives realize, unless, as the president says, we bend this curve of exponential increases in healthcare cost, we can never get our fiscal house in order. You can't have 54, I think, don't hold me to the exact number, but it's over 50% of the healthcare cost in America going to Medicare and Medicaid. Well, you can't have that cost of the government going up over 50% during this period. You can never get control of your budget. You cut everything else. You're going to go bankrupt. And those of us like you who have fought for this for years, even though you've had decent health care, you've fought for it for other people, what happens? We view it as a moral imperative. Well, this is the first time all 3 of those things have come together. Fiscal necessity, business necessity, and, in my view, moral necessity. Because everyone's entitled, in my view, to adequate health care. There's a beautiful young lady sitting behind me with her grandpa. He bought into a deal that looks like now his outfit may not get their health care, may get cut. What's he going to do raising his granddaughter? That's a moral imperative. So, ladies and gentlemen, we're determined to get health care reform in this country. It's moral, it's economic, it's fiscally required. And if we don't do it now for our families, our businesses, and our nation, we're going to go bankrupt, remain uncompetitive, and let a lot of people in really dire straits. It's just that simple. So we have to put an end to denying coverage for pre-existing conditions. We need to get costs under control. We need to level this. And that's why we believe in a public option, to make sure that there's competition and to keep insurance companies honest. Look, folks, this is not going to be easy. This is not going to be easy. But we know how critical health care reform is to our country. And we need to win this fight.